For the first time ever in Ontario, to our knowledge, we are bringing together over 90 individuals who are interested in bringing a focus on young carers. We have in the room policymakers, researchers, health service providers who are going to hear from young carers directly about what needs to be done to support them better.
I'm a young carer and I care for my sister who is now 30 and she has traumatic brain injury.
I take care of my brother. He's 21, he has cerebral palsy.
We are high school students who are young carers in Toronto for our grandfather who has been hospitalized for the past 5 years at Bridgepoint Hospital.
We're trying to give them a comfortable space where we can hear, and then from there we build an action plan. Caregivers in general are an often forgotten group in our healthcare system, but young carers are simply invisible.
You know, most of us will have to take care of someone we love at some point in our lives. But you are shouldering that duty at an early age, taking on what most people think of as an adult responsibility.
The first step, and arguably most crucial, is role recognition, which is why all of us are here today. We recognize young caregivers and their roles, value their contribution to caregiving, and understand the impact it has on their health and development.
As a young carer, I feel that feeling of loneliness. It's just like no one else gets it.
It's so much more than just the caregiving. It's also talking about the impact of the situation you're put in.
I think our biggest barrier still is just people knowing what a young carer is, and we're still hitting it over and over and over again. So to me, what I think that we need to really prioritize is having everyone in Ontario know what a young carer is.
And so we have to think about how do we provide resources for people to be able to care in the best way that they can and also take care of themselves. So that's something we think about a lot.
You get really creative when you have very limited funding, and you can do a lot. It makes me wonder, like, what else that could look like if we had more funding.
And also, this shouldn't be something that we are just looking at a provincial standpoint. It's something that we should be looking at to implement nationwide in all of Canada.
Mostly what we hear from are older seniors. We don't hear that much from young people. But I want you to know that our office is there. What would make the biggest difference to you from an organization or government or really anybody that would make your life a little bit easier?
The biggest thing is getting people to talk about us. The word of mouth is the best way, because then you know for sure that it's getting out there.
The Ministry of Community and Youth Services, the Ministry of Health and Long-Term Care, the Ministry of Education, actually working together on shared accountability around recognizing the value of our young carers as the backbone of support in the province of Ontario, to make it less invisible.
We have a perfect opportunity for co-design sitting right here. So we have a task force to try to figure out how do we get these ministries to talk and facilitate that with the expertise that we have in this room to figure out how to move forward. And it's going to take time and it's going to take influence.
Having everyone in this room dedicated to young carers and their needs is really, really exciting. And I know big things will come of it.
If I had any advice for young caregivers, I'd say to have somebody to talk to.
Even though you might have to step up to the plate of taking on a lot of responsibility, it's also important to focus on yourself as well.
Our hope is that the Change Foundation can help shape and start a conversation about a collective action plan that would touch on the things that you've all talked about today. We actually want to build an action plan that we can take to various systems, the education system, the healthcare system, government, to talk about what needs to be done to improve the situation for young carers.